If you're someone who's looking to start your nursing career by becoming an enrolled nurse in Australia, this video is for you. Hi everyone, this is Jessin from Edulogics, where we teach you logic behind things. My channel is all about nursing, international education, and I hope you will find this video very useful. Before we begin our today's video, make sure to subscribe to my channel and hit the notification icon so that you do not miss any of the videos that I upload. In our today's video, I am going to tell about enrolled nursing and how you can become an enrolled nurse in Australia. Now basically, enrolled nurses are nursing professionals who are licensed with Nursing and Midwifery Board of Australia and have completed a diploma of nursing. Once you complete the Diploma of Nursing in Australia, which is generally an 18 to 24 months qualification, you should be able to apply for your license with Nursing and Midwifery Board of Australia. Enrolled nurses work in a wide variety of healthcare settings under the supervision of a registered nurse, but they can also independently function as per their scope of practice. If you're interested to know what all an enrolled nurse can do or cannot do, make sure to go through the NMBA website where a detailed scope of practice for this professional is written clearly. I'll leave the link in the description box below for you to read. As an enrolled nurse, you will be an integral part of the healthcare team and will be delivering exceptional nursing care to your patients. Let's talk about the entry requirements. So number one is qualification. You should have successfully completed grade 12 or higher secondary school, and it can be in any of the stream that you may have chosen in your school. You can be from the arts background, commerce or science, and you can easily do this program. The second is basically English language requirement, which I have explained many times in my videos that for enrolled nurses as well as registered nurses, you need to have IELTS 7 in each of the modules, or OET level B or PT 65, and then only you can enter this program. Apart from this, you should meet the other requirements such as meeting the international criminal history check, working with children check, and immunization requirements. The fourth requirement is that you should be able to pass the LLN test or language literacy and numeracy test, which is conducted by the registered training organization where you are taking the admission. This exam is conducted online, so it should be easily feasible for you to attend anywhere in this world. In terms of the fees and intakes, this can vary based upon the institution you choose, and hence make sure to check the website and see what are the upcoming intake dates. On an average, the fees for the whole program will be approximately $30,000 to $35,000. Make sure to discuss about installment plans or any scholarship that are available in your institution and utilize them to your best capability. During this program, you can of course work part-time as per your visa conditions. In terms of clinical placement, there's a mandatory requirement of 400 hours of clinical placement in various healthcare settings, and your registered training organization will be able to arrange these for you. Coming to the most important point, what is the benefit of doing this program? Number one, a good salary and good job security. So enrolled nurses on an average earn between $60,000 to $65,000 in their first year. So you essentially recover your fees by working the first 6 months. Apart from this, as you all are aware, there's an acute shortage of nurses in Australia, and hence enrolled nurses help bridge this gap and definitely is a very well sought after profession. Apart from the good salary, good working conditions and job security, there are multiple universities that offer articulation pathways which will help you upgrade your qualification if you decide so. This basically means that in future, if you wish to upgrade your qualification and complete a bachelor's program in nursing, you won't have to study the whole 3 years, and you will definitely get some credits for your prior learning that you have done during your diploma of nursing. Each university as well as registered training organizations have their own criteria to assess the recognition of prior learning or the credit transfer, and hence make sure to discuss this before you take admission. I hope you found this information useful. If you did, please make sure to share it with your friends and family. If you have any questions about enrolled nursing, please make sure to connect with me. I'll leave the link of our details in the description box below. Until next time, stay safe and stay happy.